Many of us may be wondering what it may look like the next time we have our next doctor's visit. Well, Dr. Scott Nixon, the Chief of Primary Care at Salem VA Medical Center, joins us this morning to help us get a vision of what our doctor's visits will look like amid COVID-19. Good morning, and thank you so much for joining us, Dr. Nixon.
Thank you so much for having me.
Well, if I understand correctly, the Salem VA is one of the only 20 VA medical centers in the nation that's currently open. Is that correct?
That's correct, in that all of the VA centers around the country are open for emergent and urgent care. But Salem was chosen earlier in May as an early open site to begin non-emergent, non-urgent care. So that on May 26th, we started phase one of a multi-phase program to slowly and gradually and safely bring non-emergency procedures and appointments back to the center.
And the current phase that you guys are under, how long do you believe that this approach will last?
We have this set up in several phases, probably three, but each phase will last at least 2 weeks. And during that time period, we have a team that's monitoring the progress, how things are going, and watching to make sure that we can ensure that we can maintain safe care for our veterans as well as a safe environment for our employee populations. As each phase is assessed and continued, we'll move to the next phase, and that will open more appointments in more areas of the hospital that will open at that point. We're not at this point taking walk-in, and so it's more of a planned, strategic, gradual approach.
And for those that have the appointments, what can patients expect when they get to their doctor's appointment?
Well, they can expect, certainly if they haven't been in the medical center in the last few months, things will certainly look different from what they're used to. So for starters, as they come onto the campus, all people entering the campus will be screened at the front gate for COVID-related screening. Following that, we would ask that everyone bring a mask or a face covering of some type as they come onto the campus, because those are mandatory on the campus. We are still restricting visitors, and we don't allow anybody under 18 in the hospital at this point. Following that, proceeding on to the hospital, as they enter the front doors, some of the things that they'll notice are that the waiting rooms have been adjusted with lesser numbers of chairs and with more physical distancing of those chairs for safety purposes and for prevention related to COVID. There will be much more signage directing the visit and directing the physical distancing in appropriate areas, in the front desk areas, in front of the elevators. In addition, at the areas where veterans would commonly interact with staff, many of those areas will have clear plastic sneeze guards, reduce the risk to both the veteran and the other thing I think will be noticeable is just a general lesser number of people in the center, so a bit more of a quiet atmosphere than what they may be used to in the past.
Sure. Well, some of you guys are taking the necessary safety precautions. Real quickly, we only have a few seconds left. What kind of appointments are you guys taking?
At this point, during phase one, we have a limited number of surgical appointments daily. We're reaching out to the 30,000 veterans in 26 county area, explaining the changes that are going on. As we move to the subsequent phases, more and more of those clinic appointments will open up, but with the goal of identifying those people with the greatest and most critical need to get into those appointments first.
Well, it is wonderful to know that you guys are open, although in a limited capacity, that you're able to serve our nation's heroes. And we are grateful for what you guys are doing and keeping everyone safe. Thank you so much for your time this morning, Dr. Nixon.
Thank you very much for having me.
And coming up next, we check in with Mill Mountain Theater, their plans for summer 2020.